cervix has to dilate to about 10 centimeters. So mostly it's closed, but during childbirth it has to dilate to that. So most women, when they start feeling those pains, it's just the cervix opening up. So it has to open up to, sometimes you go to the hospital, those who have given birth, you go, they do a vaginal examination, they insert the fingers just to measure the centimeters of, dilation. So you need to dilate to about 10 centimeters before you can go into actual labor. Yeah, so that is the role that the cervix plays. And also with sperm entry, you know, sperm has to enter the uterus to be able to fertilize egg. So the cervix being the door of the uterus, it helps with sperm entry. So there are certain mucus production within the cervix that is quite selective. So it's selective in what it allows in. Yeah, so there are certain sperms or there are certain bacteria and other things within the vaginal area that are not supposed to enter the uterus. So the mucus production within the cervix area will prevent those entry. So some people may get infections within the vaginal area, but it wouldn't necessarily enter the cervix because of those protective mucus within the cervical area. And also when sperm is being introduced into the woman, the cervix helps, the mucus that the cervix produces helps the sperm to swim within there. So the prostatic fluid within from the man will help with the sperm swimming in, but the cervix is what opens up to allow the sperms to enter within the cervix. So
Dr. Prince, this image is speaking to what exactly?
Yes, so this is a transverse section of the female of the uterus. So the cervix is just the down part. The vagina is the distal part, and just close to the vagina is the cervix. So the images on the right side, that is how the cervix looks like. So mostly it's closed. So that is how a typical cervix looks like. It's closed. So when menstrual fluid is coming out or sperms are entering, it opens up to allow that. And with that, you know, during the female cycle, there are times that the cervix is open, and mostly that is around your ovulation period. Around the ovulation period, the cervix opens up and the mucus becomes quite clear. So sometimes women get certain clear discharges around that time. Those clear discharges what helps the sperm to swim well into the woman. Yeah, so the cervix plays those major roles in childbirth and also preventing infections within the uterus. So that it wouldn't cause any of these issues. But with all this protection and all these things going on, there are some women who may still get infections within the uterus itself. So sometimes there could be some break in the barrier and all that, which allows infections to enter the cervix, causing so much problems with childbirth. So that is what the cervix basically does.
This is another image looking at a normal cervix and what? And what was that? A
nabothian cyst. Yes, so it's one of the conditions of the cervix. As I mentioned, there are so many conditions that could affect the cervix. So
we might as well begin with this one.
Yes, so the nabothian cyst is just a fluid-filled blisters that happens around the cervix. And when it happens this way, it causes painful sexual intercourse. Because definitely when the penis touches the cervix, you feel pains when these cysts are there. But normally on the left, that is how the normal cervix should look like. But when you have those nabothian cysts, this is how it looks like. So there are some women who may say that sometimes some women, when they are cleaning themselves, they can go that deep. Some women come to the hospital.
Go as deep as into the cervix?
Yes, that is not advisable though, but people come to the hospital and complain that they feel certain things around those places. And when we use a speculum to check, you see that some of these nabothian cysts are there. When it happens like that, it makes the cervix not able to function properly. The mucus production goes down, the opening of the cervix could be reduced. And sometimes it can affect fertility, because when the cervix is not opening up, it means that sperm wouldn't be allowed to enter the cervix. And in effect, it could cause some of these infertility issues.
But what causes these nabothian cysts?
Yes, so infection is one of the things that could cause. Several things that some women do, like douching. You know, we've always talked about we not inserting things within there. And as I mentioned earlier, some women goes that deep when they are washing. Actually, you should just wash the vaginal area, not deep into the vagina.
With just water?
Yes, with just water. No soap, just water. The vagina naturally has some bacteria which protects the place. And as I mentioned, the mucus production from the cervix is also a barrier to prevent infections from entering there. So if there is any infections within the vaginal area, it wouldn't be able to go in there. So you don't have to try to clean yourself. You can't do that. So don't be going that deep. Yeah, the best way to find out some of these things is through a vaginal examination. That's why it's advisable that from time to time you need to do a vaginal examination to make sure that some of these conditions are not there and the nature of the cervix is intact and all that. Yeah. So we talked about the Nabotheon cyst. There is also stenosis of the cervix. Sometimes the stenosis. Yes, stenosis is just the narrowing of the cervix. So naturally there are certain conditions that could cause the cervix to narrow, and also during surgery there are certain surgical conditions that can also cause the cervix to narrow. Yeah, so those stenosis can prevent opening of the cervix. So when it happens like that, getting pregnant could be an issue. Yes, so those stenosis could affect the nature of the cervix, and it doesn't allow for women to be able to get pregnant. Sometimes when we are looking at fertility, we just look at just the basic ones, but mucus production even around the cervix could affect fertility. So all these things play a major role when it comes to fertility.
Okay, you mentioned surgeries.
Yes.
Is it common to have this from surgeries? And if it is, what sort of surgeries?
Yes, so any surgery that has to do with the uterus, so cesarean section, other from myomectomy and all those things, they could, when the suturing is being done, sometimes looking at the location of the fibroid for the myomectomies, sometimes the fibroids are close to the cervix. So they are cervical fibroids and all that. So when they are being taken out, sometimes it could affect the nature of the cervix, and it could allow, it wouldn't allow the cervix to fully dilate properly, and later on it could affect some issues with fertility. We also have major condition called the cervicitis, which is this infection of the cervix. That's the first image that we saw. Yeah, so the cervicitis, you know, as I mentioned earlier, there shouldn't be infections within the uterus. So sometimes, yes, the image below, you know, the normal one is up there, and there is you see that some fluid, some yellowish discharge. Yes. So when you have cervicitis, that is what you mostly experience. So most women come to the hospital with vaginal discharge, and mostly it's yellowish, it smells. Naturally, the vagina has its own odor, but it shouldn't have any unpleasant odor.
Like a fishy smell.
Yes, so when you start seeing some of these things, it could be that the infections probably might have traveled to the cervix, and it's causing those discharge to come in. Yeah, so those are some of the things that could affect the cervix. Apart from that, people can have what we call the cervical polyps. So the polyp is quite similar to the Nabotheon cyst, but with the cyst is fluid filled, but with the polyps it's just the cells that has let's say overgrown. So
like an overgrown bush.
Yes, so there was an image that we showed earlier. So this is mostly a cervical polyp. So you could see that the cells of the cervix has overgrown, and it sort of closes or blocks the opening of the cervix. So when it happens this way, it can prevent women from conceiving, because when it happens this way, the opening of the cervix is affected, and sperm wouldn't be able to enter. Sometimes it can even affect your ability to menstruate, because when the opening is closed, it means that the menstrual fluid wouldn't be able to come out from your uterus. Yeah, and all those accumulation of menstrual fluid and all that could cause certain problems with the endometrium or the uterus itself. Yeah, so some of these conditions, the cervical polyps too, could affect some of could cause some issues with the cervix.
Is it very common?
Yes, we see them. It's not so common, but it's some things that happen. You know, when it comes to fertility, there are some women who may have done ultrasound, everything looks fine, but still the pregnancy or the conception is not coming. Sometimes we need to take a closer look at the cervix, because as I mentioned, that's the gateway to the uterus. So if there is any issues with conception, it could be that there is a problem. Problems like the stenosis that I mentioned about could affect fertility, because it wouldn't allow the sperms to go in. The polyps is another thing. With the nabotion cyst that we mentioned, it causes painful menstruation, so women wouldn't be able to enjoy sex, so they wouldn't even give themselves out to have sex to cause pregnancy to occur. So some of these things eventually could affect fertility, and unfortunately we pick up some of these things during when women come to the hospital and they are having infertility issues. That is when we pick up some of these things. But when we do routine checkups, when we check our cervix from now and then, we'll be able to pick up some of these things, and when there is if there is any problems with it, we could be able to manage it appropriately.
Find it
early. So that it wouldn't escalate to those extents.
So Dr. after you've been diagnosed that you have one or two of these conditions, what treatment options are available?
It depends on the condition that you have. So with the cervicitis, which is just the infection, there are antibiotics that you can take within 1 week, 2 weeks, sometimes 3 weeks, depending on how severe the infection is, and it can be completely treated. Some of them may require surgery, like the polyps, depending on how big it is. Sometimes it's so big to the extent that it blocks the entire cervix, and it sometimes tries to come out because it comes out through the vagina. So there are some polyps that could grow, that they can overgrow to that extent that it tries to come out. That one, you need to undergo surgical conditions to take it out. But in the early stages, most of these conditions, when we find it out earlier, there are medications that could probably prevent further growth. There are medications that could, if it's infection, to prevent it. But for the stenosis that I mentioned, it's mostly because it's related to surgery and all that. There could be some surgical interventions that could be done to get rid of that. And there is another condition called the cervical insufficiency. That mostly happens, you can't really tell, the cervix is there, but you can't really tell whether it's able to perform its duty or not until probably you've conceived and you've had recurrent miscarriage. So most women, when they conceive and the child is developing, all of a sudden they have a miscarriage. Sometimes it's the cervix that is not able to close up to hold the pregnancy. As I mentioned, the only time the cervix should open up is when you are ovulating. That is when it dilates to allow sperms to enter, and when you are menstruating, it opens for the menstrual fluid to come out. But when you get pregnant, mostly the cervix should be closed. So there are some women, even during pregnancy, the cervix can still open, and when it happens,
this is called cervical insufficiency.
So when it happens that way, it causes the cervix to open up, and the fetus could come out, and that is what we term as miscarriage. So when it's recurrent, then sometimes when you get pregnant, some women go to the hospital and they say, they've tied it.
They have to lay in the hospital the whole time, for the whole pregnancy.
Mostly the cervical insufficiency is one of the things that causes some of these things. And another condition that we know of the cervix is the cervical cancer. That one, we've heard a lot about it, and it's something that we need to pay particular attention. Apart from the cancer, there are these conditions. So when we are doing the screenings for some of these conditions, the cancer and all that, we are not just looking for the cancer. All these things might be picked up. So we don't have to be so afraid to go in to do some of these tests. Sometimes we may pick an infection, we may pick certain things that could easily be treated. But if it's not treated and it continues, then it could lead to certain conditions. The cervicitis, even the infections that I said, could be treated with antibiotics. If it's not treated well and you keep on, like it keeps on developing, it can affect some of the cells within the cervix, which could eventually lead to cancer, and it can affect a lot of women. So picking up some of these conditions earlier can help to solve most of these chronic medical conditions.
So what happens to the lady's partner in an event that any of these conditions is not picked up early? and they are still having active sex.
Yes, so it depends on the type of condition. With the polyps, you cannot transfer it because it's just the cells that are overgrowing. With the infections, mostly the cervicitis is what could be transmitted. Yeah, when a woman has a sexually transmitted infection, which is not well treated, eventually it can cause the cervicitis, and that's STI could be transferred to the woman, the man. The man wouldn't get cervicitis because men don't have cervix. Yes, so they wouldn't have cervicitis. But then, when the infection is being transferred to the man could have an STI, which can also lead to prostatitis. It can lead to other conditions within the man because the organs within the men are different from that of the women. The same way, if a man has an infection which probably could affect the prostate, like prostatitis, as I mentioned, it can also be transferred to the man. The infection can be transferred, not the condition. So the infection, when transferred, can affect any of the organs there. When it affects the cervix, that is what we call the cervicitis. When it affects other organs, we have vaginitis, we have other forms of infections within the vaginal area. So depending on what
vaginitis is only virgins that catch that one.
No, vaginitis is from vagina. So if you have an infection that affects the vagina itself, that is what we call the vaginitis. But when it travels up to the cervix, it's called cervicitis. Sometimes it can go up to the endometrium, affecting the endometrial lining and all that. Yeah, so infections can travel, so we need to look at that. And some of the risk factors I quoted a bit, being female is one of them because yes, you have the cervix, you can get the infections there. Untreated STIs, as I mentioned earlier, can also cause. Douching, I mentioned that earlier. It's very important. We need to look at that because a lot of women are suffering from some of these cervical conditions because of the things that we put there. Back in the days, our mothers used to insert ginger and other things there. Yes, but now they stop. When the children misbehave, oh yes, so all those things could affect the nature of the cervix, so we need to look at that. And also childbirth. Unfortunately, the more you have children, as the cervix opens and closes up, there could be some insufficiency and other issues affecting the cervix. So childbirth too is a risk factor to affect cervical conditions. And with the diagnosis, as I mentioned, we can do a pelvic examination, you can do an ultrasound. We have a transvaginal ultrasound. So apart from
what's that?
So as the name implies, transvaginal, we check the cervical area through the vagina. So yes, there is a probe that we can insert through your vagina to check. That one is more advanced than the pelvic one that we do. So sometimes if the pelvic is not picking up, we may do a transvaginal ultrasound. We can also do an MRI to find out if there are other issues there. And also we can do a pap smear. I believe
I was going to ask if that was the same thing as the...
No, pap smear is quite different. For pap smear, we use a speculum to dilate the vagina, then take samples of the cervix to check. And with the pap smear, for women between 21 to 29, you need to have it every 3 years. So if you are within 21 to 29, you need to have a pap smear every 3 years. And from 30 to 65, you need to have it every 5 years. And that one, from 30 years, you need to do another test that we call the human papillomavirus. Because that one too is another virus that can affect the cervix and can lead to cervical cancer. Yeah, so for between 30 to 65, you need to do the pap smear every 5 years and also do the HPV test every 5 years to make sure. But above 65 years, it's not really advisable unless you've been having certain conditions that needs to be checked. But mostly after 65 years, you may not have any issues. And some of these cervical conditions may not cause any symptoms, but some few people may have painful menstruation, painful sexual intercourse, infertility, and also bleeding PV. So if you start seeing blood unusually coming out from your vagina and all that, it could mean that there are issues going on, within the cervix. Yeah, and you need to get checked.
What's cervical dysplasia?
Yes, so that one is the cells within the cervix when they overgrow. The conditions are a lot. I couldn't exhaust all. Yes, that is one of them. That is one of them.
What happens then?
So when it's just like it's a benign condition. It's not a cancerous issue. So that one too, when the cells of the cervix multiplies abnormally, it causes. It can lead to the polyps that I mentioned earlier. Yes, so the dysplasia is just the multiplication of the cells within the cervical area, and sometimes it can cause the cervix to be dilated. It can become
insufficient.
Yes, and it can become big. Yeah, so when it becomes that bulky, it means that it could affect certain issues within the cervical area.
Is it advisable to sort of clean, in the quest to clean ourselves and our vaginal cavity, to sit on warm water and salt? Is that advisable as a natural remedy?
Some people do that. For salt is a natural thing, but those other chemicals that we use there, that is where there is an issue. You know, when there is a tear within the vaginal area, the salt can help with the healing, and if there are certain infections there, it can help. But it shouldn't be a constant thing. You can do it once a while, but it shouldn't be a constant thing.
So that instead of douching?
That is better. That is better. But even with that, we don't have to force the fluid in there. It's just for the outer parts of the vagina. We don't have to force things in there. The vagina has a natural way of cleaning itself. We don't have to try to help it. It can help itself.
So, Doc, in wrapping up our conversation, two take-homes from this, that somebody's watching, they can easily share that one to some person as a form of awareness.
So we shouldn't be afraid of checking ourselves, especially as women. We need to do a cervical examination to find out if there is any issues with the cervix. And also, we should stop douching. If you see anything, you need to go to the hospital to get it checked, and if there is any medications that can be given to, that could be done for you to be okay.
Right. Thank you so much. Wishing you a splendid Tuesday and a great week ahead. This has been our conversation on cervical cancer and all conditions that are affecting lady area. This month of January is set aside to promote everything awareness around the cervix. Our guest in studio has been Dr. Prince from Medi Moses, and one take home is that, ladies, just go check yourself, Go check yourself, presumably on your birthday. Go get checked and see that condition early. We'll see you in our next segment. Meanwhile, the conversations to expect, the John Mahama administration's expectations of the business economy. There's also the headlines with CAF and the gentleman. Jay is going to be passing through some birthday diaries. We're also going to be looking at 15 years of life and legacy, Trigmatic and Plucked. There's more on the show. Stay tuned.